Hello, everyone. My name's Deborah Garlick, and today's session is lifestyle medicine and menstrual health. And I have the wonderful opportunity of interviewing one of our own directors, Sally Leech, who's going to be helping us explore this topic. And I say explore, Sally, because this one was new to me when you said, actually, why don't we talk about this on one of our next Lunch and Learn? So I'm going to start right at the top and say, what do we mean by lifestyle medicine, and what does that have to do with menstrual health?
Absolutely. So it's a really great place to start because I think lifestyle medicine may not be a term that we use, but we often talk about the way we look after our bodies or the kind of lifestyle approach to our menstrual health. And we also talk about this when we're talking around menopause. And it's really about the kind of evidence-based daily behaviors that support kind of long-term health and looking at our well-being. So when we think about menstrual health, it's things like nutrition, it's things like movement and exercise, it's sleep, it's how we might manage our response to stress, and that kind of social connection, awareness of our own menstrual cycle. So there's lots of things incorporated in it. And I think when we think around our menstrual health and why this is so important is because our hormones really interact with pretty much every system in our body. So our hormones can affect our metabolism, it can affect things like inflammation, it can have an impact on our stress response, our brain chemistry, how we sleep, our gut health, our emotional well-being. So it means when we think about what we eat, the way we move, how we sleep, how we manage stress, those things can really influence how we might feel throughout the menstrual cycle. And it's important, we're going to come on to talk around some of the menstrual health conditions and recognizing lifestyle medicine is not there to replace medical treatment. And some of the conditions we'll talk about, they're real conditions that deserve appropriate health care. But lifestyle medicine can very much work alongside medical care to meaningfully improve someone's quality of life. And say those things can directly influence how someone might experience their menstrual cycle. And when I talk about menstrual health, I always want to remind ourselves that menstrual health is more than just about periods. It's about that kind of physical, mental, emotional, and social well-being in relation to that menstrual cycle. And that can have an effect over the whole month for some people. It can affect things like energy, mood, sleep, concentration, the pain people may be living with. And all of those lifestyle factors that we think about when we come to lifestyle medicine can influence those things.
And I'm pleased that you said it's not just during the menstruation cycle, because I would have to say, and I am going back in memory here, when I had my period, all I ever wanted to do was sit and do absolutely nothing, maybe watch TV, eat chocolate. I was really, really sluggish. But that is just a few days in your cycle, isn't it? What you're talking about, it sounds, is actually building up your general health through lifestyle so that you can adapt and, if you like, manage those bumps.
Absolutely. And I think it's that recognition that for all of us, the way we look after ourselves can really have an influence on our health and well-being. And I think when we start to delve into what in particular how menstruation can affect people, and in particular how certain menstrual health conditions can affect people, that actually the way we take care of ourselves becomes a real priority, but we often don't prioritize that. And when we think about some of the challenges people have in terms of accessing healthcare support, in terms of feeling like, oh, it's just periods, you've just got to get on with it, that whole kind of messaging we have around challenges around menstrual health. It's really easy for us to not prioritize it and actually really listen to our bodies and what's going on. And so that's why, to me, this is such an important part of the whole way we look at taking care of ourselves, especially when we have challenges around our menstrual health.
Well, and when you say that, that was interesting because you differentiated there around the menstrual health conditions. And at no time would we say, actually, if you're experiencing endometriosis or PMDD, go for a walk in nature. They do have to, you've got to be really careful that we don't try to demean those symptoms and those conditions by saying everything's going to be resolved through lifestyle.
Yeah, absolutely. I think it's really important that we recognize that lifestyle medicine can be very powerful. but it isn't a replacement for medical care. So when we do look at conditions like endometriosis, adenomyosis, fibroids, PMDD, PMOS, they are real medical conditions. They may need investigations. There may need to be further kind of interventions in terms of diagnosing. There may be hormone treatments, medications, surgeries, specialist care, mental health support. There's a huge amount going on, and we can come on to talk around some of those conditions specifically in a moment. So lifestyle changes alone simply won't be enough. And that's not a failure on the person who is experiencing those. These are really complex conditions. And one of the really important messages we always want to get across is that we don't accidentally kind of create that feeling of blame, of the message that lifestyle medicine is, well, if you just eat a bit better and exercise, things will be okay. And it's a really harmful message, and that's not the message we want to get across. Lifestyle support can really work alongside medical support. It's not an either or. And the best outcomes often come when they're both happening together. So someone's getting the medical care they need, and they're supporting their body through daily habits that might reduce things like inflammation or stabilize hormones, improve how they're feeling. So one of the key things I'd say to anyone listening to the session or supporting someone through this session, through what they're experiencing, is we should never be dismissing what someone's experiencing and say, well, try change your diet or try and do a bit more exercise before you see a doctor. If someone is having significant symptoms to do with their menstrual cycle that are having an impact on their quality of life, people should always be accessing help and support. And we've got a great lunch and learn we did recently with Dr. Claire Spencer, which is available on the Henpicked site, which was exploring how do you actually go and talk to your GP around menstrual health conditions and some of the challenges we know we have around that. So we'll make sure we include that in the information following today's session, so people can access that as well to help with those conversations and how we access that support. Oh, sorry, Deborah, I can't hear you at the moment.
Oh, wow.
There we go, come back again.
Thank you. I want to take you back to what you said right at the beginning, which was evidence-based, and then break down some of those different components of lifestyle. And thank you to everyone that's putting some messages in the chat. Yes, it does feel like the hot weather is getting in the way of some of our tech today, but don't worry, we are recording, so we'll make sure we send that over to you. So Sally, can I take you back to evidence-based?
Yeah, absolutely. So I think one of the key things when we talk around menstruation and menstrual health and lifestyle medicine is there is really clear evidence around how changes and how focusing on those things can actually make a difference. And I think it's probably easiest if I break it down by some of the menstrual health conditions to understand, well, why would changing or focusing on what I'm eating, how I'm sleeping, how I'm moving, why would that make a difference to that particular condition? So we start with PMDD, premenstrual dysphoric disorder. So for anyone that doesn't know, PMDD is not simply bad PMS, premenstrual syndrome. It is a serious clinical condition characterized by an increased sensitivity to hormonal changes during the menstrual cycle. And typically those symptoms occur during the luteal phase, that second half of the menstrual cycle, and often improve shortly after menstruation begins. And some will feel relatively well for kind of part of the cycle and experience really significant changes in mood, thinking, and functioning during that second half. And this is where some of the challenges around diagnosis of even people being misdiagnosed for things like bipolar, because of this real kind of split difference in how someone's experiencing their thinking and the way they're functioning between those two halves of the menstrual cycle. And one of the things when we talk to people who are experiencing PMDD is that there can be some quite good reframing to do, where it's rather than thinking about what's wrong with me, it's actually that shift to what's my body telling me right now. And that can be really quite transformative for people. Because then focusing on in particular, that second half of the cycle, how can we take care of the body? How can we be kinder to ourselves during that time when things may feel really challenging? So particular focuses around PMDD are things like blood sugar stability, sleep hygiene, regular movement, and stress management. But as I say, recognizing this clinical condition often will require medical support alongside those lifestyle approaches. Then we've got endometriosis. So this is a chronic inflammatory condition. So this is where tissue similar to the lining of the womb grows outside the womb. The tissue responds to the hormonal changes throughout the cycle, building up, breaking down. But because it's outside of the womb, it's got nowhere for that tissue to leave. So it leads to inflammation, scarring, adhesions, chronic pain, and those ongoing symptoms people may be aware of when it comes to endometriosis. Endometriosis requires medical support, and that could be anything from pain management, hormonal treatment, surgery, specialist care. But lifestyle medicine won't replace that. But because it's an inflammatory condition, lifestyle strategies can meaningfully support symptoms management. So we think about nutrition. Many people may benefit from focusing on whole foods and fiber, healthy fats, omega-3s, and reducing the kind of ultra processed foods. So it's really supporting that inflammation management and kind of gut health that can be really important, especially when we think around some of the symptoms people may have when it comes to endometriosis. Things like gentle movement, so walking, yoga, swimming, stretching can improve circulation, reduce stiffness, support that emotional well-being. And fatigue management can be a major area when it comes to endometriosis, because it's living with chronic fatigue can be quite a common part of endometriosis, especially when we think of some of the complexity of some of the treatments people may be experiencing as they're dealing and managing with what they're experiencing. It's not simply tiredness. And I think that's really important when we think about things like pacing, rest, sleep. Those can be really important tools in the management of a condition like endometriosis. And I think that whole piece of resilience when it comes to endometriosis, and again, if anyone's not seen, there was an amazing documentary short film that won a BAFTA called This is Endometriosis. There's been documentaries recently on the BBC really highlighting the challenge of living with a condition like endometriosis and the impact this can have on people's quality of life. And so those things that can be supportive in taking care of somebody when they're experiencing those symptoms is really important. And it leads us on to adenomyosis, which is often not as well known as endometriosis, but it's that same experience where tissue that normally lines the womb grows into the muscular wall of the womb. So with adenomyosis, pain can be quite significant, but also with both adenomyosis and fibroids, heavy bleeding can be really common. And so things like anemia and low iron can be a real challenge for people when people are feeling particularly exhausted. So for anyone that is experiencing those conditions, checking iron levels is really important. And then thinking about how that can be supported, in particular from a nutritional point of view. So iron-rich foods, including things like leafy green vegetables, lentils, beans, red meat, if you eat meat, fortified cereals, and sometimes iron supplementation may be needed. So always worth discussing with your GP. And then the final area I just wanted to mention is just PMOS. So most people may know this as PCOS. So it used to be called polycystic ovary syndrome, but it's been recently renamed as PMOS, polyendocrine metabolic ovarian syndrome, which is a mouthful to say. PMOS is much easier. And the change is significant when it comes to lifestyle management because PMOS isn't simply an ovarian condition. It's much more strongly linked to hormones and in particular metabolism, which the previous name didn't really incorporate into. So it reflects that what's happening across the whole body. And lifestyle medicine, as I say, plays a really important part in influencing insulin resistance, hormone balance, metabolic health, and the severity of symptoms. So again, going back to think about some top tips, nutritionally balanced meals with protein, fiber, healthy fats can help support that blood sugar stability. Regular movement, including walking and strength training, that can really improve insulin sensitivity and metabolic health. Sleep quality matters because we know sleep can really affect things like our appetite hormones, insulin sensitivity, our stress hormones, and stress management obviously becomes part of that. But I think again, with people living with PMOS, going back to that messaging we were talking about, it is really important to recognize that PMOS often really fights your body in terms of, a lot of people with PMOS may have challenges around weight gain, and we've covered this in sessions on PMOS before. And just saying to somebody with PMOS, you need to lose weight, that's really hard because the body is actually fighting against that. Somebody's metabolism is really affected. So it's really important to take those moments to think about what is it that I can do that can help to support myself with the condition that I'm living with.
Wow, Sally. I know I could talk to you and listen to you for hours around all of the different conditions. Whenever I hear you talking about a menstruation and the cycle, but then all of those different conditions, there's an awful lot that many of us could be contending with. And I know your passion is for everybody to understand this and for people to get the right support. So what I'm hearing from you is you can do this for yourself. You can get involved with looking at your own lifestyle, maybe doing a bit of an audit and saying, what can I do to help myself? But at the same time, also, if you're experiencing those conditions, get extra help from your healthcare practitioner.
Yeah, absolutely. And I think this is where it's so important. We should never just be looking at lifestyle medicine when it comes to menstruation. So many people live with symptoms for years without getting answers. Often symptoms are really normalized, dismissed, or misunderstood. Hearing things like, well, periods are painful for everyone, or heavy bleeding's normal, or maybe it's just stress, or maybe you're overworked, and not really taking that time. And often then people start to question their own experiences and thinking, well, everyone else seems to manage with their periods, why don't I? And that minimizing of symptoms and minimizing of what the impact it's having can really delay seeking support. And often people will stop asking for help altogether. So self-awareness is really important. So the way we kind of approach somebody taking control of their kind of menstrual health is first of all tracking symptoms. So starting knowing your own normal, because everyone's cycle is different. Having different cycles is a very normal part of life, but recognizing what feels typical for you, tracking any symptoms you're experiencing. And one of the big things we always say, especially when someone's going to get healthcare support around this, is not only tracking physically or emotionally what you're experiencing, but what impact is that having on your quality of life? What are you not able to do because of that? So is it missing time off work? Or I can see someone asking questions around their daughter. Is it, people having to not be able to attend school? Is it not doing social activities? Is it finding that you can just about manage things at work, but then everything else you just have to rest the rest of the time because you can't function? Getting across that message of the impact this is having is really important to help being taken seriously, to say you want answers, you want to understand, and you want support in how you're going to approach that. The tracking of symptoms really helps provide information to your GP or healthcare practitioner of what might be going on. When we think about diagnosing some of those conditions, so PMDD, for example, tracking that symptoms are occurring in that second half of the menstrual cycle is really important as part of that diagnosis. Because if someone's experiencing symptoms all the way through their cycle, it would be unlikely to be a PMDD because that is the definition of PMDD is in that luteal phase. So really important to help with the diagnosis and those conversations. And that reassurance that you know your body better than anyone else. And if something feels wrong, if something's affecting your quality of life, it is worth exploring. And that kind of almost telling yourself you're not overreacting and not allowing yourself to be dismissed. In terms of from a lifestyle approach point of view, we always talk about focusing on small, sustainable changes and doing this from a place of self-care and kindness, not a kind of that focus on, oh, well, if I was just doing these things, I'd be able to manage better, or I should be doing this, or I shouldn't be doing this. We know that can cause a lot of anxiety, a lot of additional stress, which again, we know doesn't have a positive impact on our bodies. So small changes can make the biggest difference. So one improvement in what you're eating, one improvement in how you're moving or exercise, one improvement in how you're focusing on your sleep. When we start to do those consistently rather than this big complete overhaul, which is unsustainable and often really challenging, those can really make a big difference. And as I say, it's amazing how quickly those changes can really add up. And yeah, create that kind of meaningful change. But what I would say is if people are experiencing challenges, seek support early. Don't wait until things are at their worst. Don't assume you'll be dismissed. Um, ask for second opinion. I can see someone saying that they're feeling very dismissed, or their daughter's feeling very dismissed around what they're experiencing. Seeing if there is somebody else you can see, I think that's really important. And we see that a lot, don't we, Deborah, in terms of challenges
Yeah.
around accessing support.
And I loved, if you get the opportunity, watch the previous lunch and learn with Dr. Claire Spencer when she was talking about how to talk to your healthcare practitioner about menstrual health. But actually, Sally, and I know you and the team do training in the workplaces all the time, and that whole what is normal when we're all brought up to or told, it's a 28-day cycle, it's this, and so many people being told that's just part of being a woman. But actually, that whole know your normal, I think, is really, really important in all of this.
Yeah, absolutely. And then I think it's breaking it down and starting things. So we think about nutrition and we think in that those general top tips of what we can think about. We have thinking about having a balanced diet. When we think about, balance of protein, healthy, or a real kind of eating the rainbow. I know when we do sessions with Jackie Lynch around nutrition, we talk around making sure we've got plenty of fruit and veg, plenty of fiber, starting to look at the things we can maybe reduce out of our diet. So the processed foods, the sugar, having a look and seeing how things like alcohol or caffeine or anything like those impact, again, depending on where we are in our menstrual cycle. And I think that intelligence that we can take to looking clearly at what's going on for me is really important. And sometimes when you think about some of the nutrition tips that we have around these things, you think, well, those are just the basics. But how many times do we actually take a step back and look at what am I doing that supports my body well? And what am I doing that's maybe not supporting my body well? And then of those things that I'm doing to support, what else could I do to start to do more of those? And how can I start to reduce those things? But not doing it from, as I say, this place. I mean, we often talk about the from Monday approach, which is like from Monday, I'm going to go to the gym 3 times a week. I'm going to bring in home cook. If I work in the office, I'm going to bring in home cooked meals every day. I'm going to do go for a walk at lunchtime. I'm going to go to bed early. I'm going to, start yoga again, all of those things. And we put this massive pressure on ourselves to try and change everything at once. And then when we don't do all of those things we've put on our list to do, we then feel guilty. We feel it's our fault. And we get into this real vicious cycle. And this is why we focus so much on small, sustainable changes, because they are genuinely what makes the biggest difference. And it's then all about that self-care supportiveness. How am I taking care of myself rather than how am I beating myself up for what I should or shouldn't be doing?
I'm sorry, I was just giggling there because you could see people in the chat saying, "I always start things on Monday," and it is you do, and Tuesday comes and you feel disappointed because you didn't start it. But that's actually what you can do for yourself. One comment or one of the questions that really does resonate with me is my daughter is 14 and has heavy periods, is active but can often be vomiting each month. She's had ultrasounds to rule out any further worries, not necessarily getting the support. So, what can you do to support someone else? Because many of us have daughters.
Yeah, absolutely. And I think this is one of the areas we've focused on a lot with organizations, because we do have people in organizations almost coming to their organization saying, what help can you provide for me to actually look at how I can support my daughter around their menstrual health. I think the fact that you're talking about it with her and you're aware of what's going on, I think that's really important. These are really important conversations to have. I think also the encouraging that tracking of symptoms, those knowing what's going on, again, really, really important. And I think then the kind of that advocacy piece, because when you're 14, I think going to see your GP or your healthcare practitioner, it's really hard. And I'm sure by the sounds of it, you're very involved in that. But I would go back and say, is there somebody else that you can see within your practice who maybe has particular additional educational knowledge around women's health, around menstrual health? Talk to them about the impact this is having on her life. I think is really important, because if she's vomiting each month, that is going to be things she's going to be missing out on, things, it's going to be potentially affecting attendance at school or social activities, and focus on that to say that this is not something that she can put up with. We need to understand what's causing that and what we can do to manage it. In terms of over-the-counter medication, so one of the big things when we talk with, and again on the last Lunch and Learn, and we will post, I know someone's asked where to do, you can go to the Henpicked site, but we'll make sure we share that with everyone following the session. But Dr. Claire talks about it in the last session that there are sometimes some more over-the-counter medication or things like the contraceptive pill that can actually be really helpful in managing some of the symptoms of what might be going on for someone. So one of the encouragements is not to necessarily dismiss some of the medications if they could be helpful, but still pursue to understand, well, what is causing this? Why is this happening? So that you've got a good understanding. So it's about maybe managing symptoms in the short term, but making sure that investigation still carries on to understand and get to the bottom of what is it that's causing these challenges. Yeah, and then I see Deborah's just popped in the Henpicked link there. It's really hard. It is really hard, and you just want to take it away from them. You want to solve it for them. But the fact that you're so involved with that already and you know about these things, one of the most challenging things is when daughters don't feel they're able to talk about how they're experiencing things. The fact that she knows that those periods aren't normal and that that she shouldn't be struggling, stuff like that, and she's getting those investigations started. That's a really great messaging you're sending to her to say, if this is affecting your quality of life, do ask for help.
And as you say, Sally, very often when you make the appointment, because it's sometimes a little bit, it feels a bit strange for people to say, who in the practice can I get a second opinion from? But actually making another appointment and asking the receptionist, who in the practice has a specialist interest in women's health and menstrual health conditions, might actually put you through to a different doctor.
Yeah, absolutely. But I think, as I say, to me, the biggest thing in that particular case is making it clear the impact this is having on her quality of life, on her participation at school, social activities, and say, because of that, this is a real priority that we understand what's going on and what we can do to help and support and manage that for her.
That's wonderful. And as you say, yes, I did put a link to the henpick.net website because it's got a wealth of all of these recordings. So if you want to watch this again, you can go to the henpick.net website. Usually takes a day or so to get the video up and running on there, but you can watch the last one, how to get the help and support from your GP. There are lots of things around different menstrual health conditions, and whether it's a webinar you prefer, a podcast, or whether it's actually the transcripts, because many of us like to read things rather than just watch them. Michelle was saying, we mentioned contraceptive pills. Suggest do your own research on that. Be aware of be aware it contains synthetic chemically altered hormones. So guess what, Michelle? We've got a wonderful webinar with Kate Muir talking exactly about that because yes, there are different contraceptive pills. Some do contain synthetic hormones, but which can actually trigger other types of symptoms. So I recommend that you watch that one as well. There is a search function on the website, so just pop in the questions in your search and it should pop up for you. But we recommend that one too.
Absolutely. And also, in terms of managing symptoms, not all medication is hormone based. There are medications that can help with managing heavy bleeding that are non-hormonal based. So again, this is about those informed conversations with a GP to look at what are the options. And we always say when you're being given options in terms of treatment for whatever you're experiencing, is there's 4 questions we'd encourage you to ask. Why are you recommending this treatment for me? What are the alternatives? What are the potential side effects or impacts? And what happens if it doesn't make a difference? And what's the next step? Because then you can go into that decision making. Some medications will be right for some people, not right for others. It's all about what is right for you as an individual and your own medical history. So it's so important that yeah, we do that. And I think that's a really great point, Michelle, to say it's got to be that informed choice. And yeah, that session with Kate Muir on the pill is really helpful. We can't go into all of that today, but yeah, it's really great.
Absolutely. And as Yvonne was saying to everybody in the community, and thank you very much for all of your questions and comments, everyone's experience is different. And I'm going to give you the opportunity of doing a final shout out, Sally, because we've got a question from in chat saying, been to the GP several times, armed with information, believe it's PMDD. Would you suggest going to a different GP? But I know, of course, the PMDD project is an organisation that you're very much connected to.
Yeah, absolutely. There's some really great information on their website. Again, we'll include that in the write-up, and because there's some really great information there. I mean, there's so many things that we can talk about that are being brought up here. Someone's put in there around English-speaking women getting support, but where English isn't their first language. Absolutely, there are so many health inequalities around menstrual health, whether it comes to language, whether it comes to cultural conversations, whether it comes to healthcare inequalities, that feeling of being dismissed. There are certain conditions like fibroids that are more common in Black women, and less common to be diagnosed. There's so much inequality around this that I mean, that's a whole other session that we could run and talk about. Really important that we recognise that it's why everything we can do to share information, share resources, encourage people to access resources on Henpicked. If you're part of a menstruation friendly organisation, encourage them to access resources through the organisation so we can try and start to overcome some of these barriers. It's a journey, it's going to take us time. But yeah, really, really important that we are having these conversations.
Thank you, Sally. And I'll leave it on Michelle's comment, which is exactly right, Sally. We need to take our own part as a patient too about the choices of any medication that we have. So thank you very much to Sally Leech. Always a pleasure. And thank you for exploring this topic with us. And thank you very much for joining us today.
Thank you.